Hi, question from our social media platform. Do I have to wait until I'm 25 years old to have a hair transplant procedure? The answer is it depends. I have patients that have had transplants before age 25. I have patients that I did not recommend surgery until they're after 25. Basically, when you look at the knowledge of hair loss that we have, there's not a cutoff age. It depends highly on the characteristics of your hair, how much hair you've lost, how much hair I can see that you're going to lose. I have to always assume the worst so I can give you the best treatment option for you and for the future, right? So when I see a patient for a consultation, I'm not looking just today, I'm looking at 10, 20, 30 years from now. These patients will carry their hair loss and their transplant for their whole life. So it's very important that we in the consultation discuss all the options. That includes invariably medications, medical therapy to try to slow down the hair loss and make sure that we preserve hair for the future. Also, donor evaluation if there's enough donor hair. One thing that's important that sometimes patients don't understand is that the hair loss will evolve and is going to probably get worse over time. So what I transplant today may not look natural in the future if there's a lot of hair loss and the donor zone is compromised because we didn't plan for it. So these are very important issues, and it's something that I see here in the office all the time. So during the consultation is the golden hour for us to discuss all these options. And sometimes I tell patients to take medication for a while to make sure that they don't have any problems with them, that they're committed to it, and then recommend a transplant if anything later on. But again, depends on your particular situation. Come for the consultation. I'll take a look at your scalp. I haven't seen this gentleman that asked this question, so come in, we'll take a look at you and give you the right recommendation. Thanks.